Good morning, Dr. Simon.
Good morning.
Could you tell me a bit about your role and a bit about yourself?
I work as a consultant in acute medicine at Mid and South Essex University Hospital at the Basildon site. I'm the clinical director for acute medicine and is also the trust license officer for clinical advisory group for COVID in pandemic. So my role is to coordinate the trust policies, guidelines, pathways, and get the organization ready for dealing with the pandemic. Obviously, I do have the clinical role where I will be seeing patients on the front line as they come through.
So, Dr. Simon, how do you manage patients coming to the emergency department?
At the start of this pandemic, a couple of weeks back, we had a trickle of patients. Now there are approximately 30 patients with COVID who come into our hospital. So we have created a separate respiratory emergency department where a patient comes in. We offer them a mask. They are ushered into our triage area. And basic investigations are carried out. If they are unwell, they are moved into a respiratory measures emergency area and are managed. Essentially, if these patients do have hypoxia, that is, if they require oxygen, we would then admit them. If they are well, if they are not requiring oxygen and if they are eating, drinking, they would just require a symptomatic treatment and recovery at home.
So, Dr. Simon, what did you mean by requiring oxygen? At what level?
So, patients, obviously, as you are aware, with COVID, they do have respiratory involvement. We do a chest X-ray. We look for lymphopenia as they come into the emergency department. These results are available. And if we are in doubt, we do a CT scan of the chest, which is a non-contrast CT. This is a Basildon protocol which we have developed along with the respiratory physicians. So that gives us a clinical situation with regards to the patient. In terms of oxygen, we are guided by an arterial blood gas or the oxygen saturation which we find on the saturation probe. Taking both together, we do have a good understanding of how unwell our patients are. Then we will be able to either admit them to the appropriate wards or we will be able to send them home. We look for a SpO2 above 94% for a safe discharge.
Where do these patients get admitted to?
We have our separate cohorted wards for COVID patients. We have classed them as low probability, some with intermediate probability, and the third group is high probability with high burden of disease. This third group, I must emphasize, are the group who are at high risk of deterioration and who would need to be managed with intubation if they were to, deteriorate. The fourth group is people with a lot of comorbidities who may not be for intubation and ventilation. And the fifth group are people, unfortunately, who are quite unwell, but because of comorbidities, age, and potential poor outcome, they are managed more in terms of symptom control. So we have cohort wards for each of these groups, which we felt was needed so that when our anesthetic team is called in to a cohort 3 ward, they immediately know they should come in ready for intubation and ready to take this patient to the intensive care unit.
So, Dr. Simon, these are very difficult times. What are the challenges you're facing to manage this situation?
Certainly, these are difficult times. One of the challenges we are always facing is the volume of cases. There is increasing number of cases who are getting admitted. The second challenge is the staff who are affected by the disease. We have had consultants from intensive care, general medical specialties, emergency department, and even obstetrics and certain unrelated specialties who got admitted with COVID. So that's a challenge. And one of the local issues which we faced was the 48 hours delay in getting the results of the viral reverse transcriptase PCR results. But we have overcome this challenge by our local radiology protocol, where if the chest X-ray is indeterminate, we do a non-contrast CT, which gives us the answer. Now, as you mentioned, these are difficult times. We have learned while we managed this pandemic in the last 3 weeks. And I think we were successful in working with our team and keeping ourselves safe, but at the same time keeping the morale of the staff high. We are quite glad that we could manage our intensive care capacity appropriately. We have approximately 50 people who could be managed on ventilators at any time. So we did face a few challenges, but I'm glad that we had solutions locally for them. Thank you.